Hello, my name is Benjamin Trussell, and this is my response to this week's discussion regarding smoking. So, starting off with the first prompt, looking at some descriptive statistics um, within Arkansas and the United States in general. These statistics are from the America's Health Rankings and the BRFFS survey, and this data was pulled most recently from 2023, and these percentages are expressed as the percentage of adults reporting smoking at least 100 cigarettes and are current smokers every day or some days. So, starting looking at overall smoking statistics here in Arkansas, we see that about 15% of Arkansas residents are current smokers, with the United States being 12.1%. Then looking at more specific factors like gender, we see that in Arkansas there are 14.3% female smokers and 15.8% male smokers. And in the United States, we see there is a 9.9% female smokers and a 13% male smokers. Now transitioning to age, in the 18 to 44 age category for Arkansas, we see 14.1% are smokers compared to the United States, 11.1%. Now moving on to the 45 to 64 year olds in Arkansas, we see that 20.5% are current smokers, and in the United States, it is a total of 14.1%. And then transitioning to my last factor, which would be race. The two that were shown to have good data that was presentable was among the white race in Arkansas, which was 15.4%, and the United States overall was at 12%. And then looking at Black Arkansans, we see that number is at 16.1% here in Arkansas, and then for the United States as a whole, it is 12.2%. So looking at these in almost every category, we see that Arkansas has increased smokers regarding current smoking and everyday smoking as well. And every category that I discussed, Arkansas has increased prevalence rate. Then kind of moving on to the second prompt here. So based off what we've learned in class, just kind of looking at these numbers in an epidemiological perspective, we see that the prevalence for every one of these statistics is higher in Arkansas. And I would almost go as far to say that the incidence is probably higher in Arkansas as well, which leads to a higher prevalence overall in every category that we looked at, whether that's age, race, or even gender, when you break it down to those specific factors. And then transitioning to the third prompt, kind of looking at why do we think that there's still a high cause for morbidity and mortality, even though we've had 50 years of evidence saying that smoking causes lung cancer. The biggest thing that sticks out to me is addiction. This is a very addictive substance, and once people get hooked, it's very hard to get off of that. So that's a big part of it there. I don't think anybody inherently wants to smoke when they know it's bad. It's more of a, that psychological factor that ties into it. And I also wanted to mention that some people just want to, kind of have a habitual habit that they do, like they want to feel something, they want to get that rush of that nicotine or, something of that nature, and it just becomes kind of habitual. Most people or that I've spoken to that smoke, they love having their cigarette right after they wake up in the morning with their coffee. That's just, it's a habit. It's ingrained in their brain. They do it continuously, and it just kind of leads to something they continuously do over time. At least that's my take on it. And then transitioning to the next prompt of what types of causation this might be in regards to epidemiology from an epidemiological perspective. So the cause that I most believe fits this would be the probabilistic cause, which basically says that smoking, it increases the chance for lung cancer, but it doesn't necessarily guarantee it. So while yes, smoking is bad, it will increase your likelihood of developing lung cancer and other respiratory issues, but it won't guarantee it. Um, as other factors do tie into it, along with like genetics and even other respiratory distress, like if you have pneumonia, um, bronchitis, things like that, kind of all are involved in determining whether someone is going to end up with lung cancer or not. And that's why I say that it's not guaranteed. If you take it away, it's not guaranteed that you won't get lung cancer either. So I feel like that best describes that process. And then transitioning to the last prompt here, looking at like why we see that those continue to do these harmful, these harmful substances and habits, even though we know it is bad for them. Um, so what other exposure kind of follows this? And I would have to say one of the most obvious answers is alcohol and alcoholism. We see that alcohol is if you use it, you are increased chance of developing liver issues, liver disease, cirrhosis, things of that nature. And it follows very similar. We have proof of this. This is something that has been studied for at least 50 years, I would say, if not more than smoking and related habits. So this is something that is equally destructive, equally addictive, I would say, in that regard. And so looking at the future, something that I could see us as public health professionals still having to deal with would be, I'd say, like diet and heart disease. Um, and that's because we see that a big issue currently, especially here in Arkansas. Heart disease is one of the main risks of death here. We have one of the highest heart disease prevalences in the United States. So I just think that that's something that we will have to continue to deal with in the future, well beyond 50 years past, because it's such a big predisposition to having heart disease. That diet. I mean, you can even tie in other related factors like exercise, um, exercise, and being not physically active. Those are two big predictors of heart disease, and that's something that we have research on. We know that being active and eating healthy can lower those rates and those odds of getting cardiovascular disease and related complications. But people still continue to act on those behaviors. And like I said, this is something I don't see going away anytime soon. So that's really why I put it as my event that we will see. And that is all of my prompts that I have. And thank you for watching.